Good day, distinguished investors and stakeholders. Today, I present a critical opportunity to transform Nigeria's healthcare system. On our slide 2 presentation, which says the most expensive healthcare in Nigeria isn't the one that costs too much, it's the one that never arrives. So, on behalf of my team, I will walk you through our current crisis, its underlying causes, our evidence-based reform strategy, and how your involvement can create lasting change for millions of Nigerians. Well, our vision is straightforward and yet profound, as it is shown on slide 11. To improve healthcare access in Nigeria by providing affordable, efficient, and technology-driven medical services for every citizen, bridging gap between rich and poor, and ensuring that quality healthcare reaches everyone. Which means by partnering with us, you will help save countless of lives and also boost economic productivity, which reduces poverty rates. Turning to slide 8 on our presentation, infrastructure shortage. Our analysis reveals alarming infrastructure gaps. Only 20% of healthcare facilities meet basic operational standards. In rural areas, less than 30% of recommended medical infrastructure exists. In nationwide, we face a shortage of 386,000 hospital beds and critical medical requirements. This means millions of Nigerians simply cannot access the care they need, even, even if they can afford it. So moving forward to our funding challenges, which shows on slide 9. Nigeria currently allocates only 3.89% of its budget to healthcare, which is far below the 15% recommended by the African Union's Abuja Declaration. This translates to approximately $10 per capita in public health spending, compared to South Africa, which is $570. This shows that chronic underfunding creates a reinforcing cycle of inadequate services and worsening outcomes that affect our entire economy. Turning on to our digital health solution, which can be found on slide 12 on our presentation. Our strategy leverage telemedicine, electronic health records, and mobile health application to overcome economic barriers, which means all our healthcare service platform will all be done digitally. So thank you. So I will use this moment to introduce one of my team members, which we call Mrs. Eunice Akman. She will continue from where I stopped. Thank you so much. So,
Thank you very much, Mr. Sheon. Good morning, good afternoon, good evening, our distinguished investors, whatever time this is getting to you. I'll be starting from our funding model. Telemedicine app seeking a $500,000 investment to launch this healthcare initiative. This model projects annual revenue of $150,000, which will break even within 5 years. And it's going to be with an affordable subscription fee of just $20 per year and a projected subscriber base of 7,500. We've actually also designed a model that balances financial stability with our social mission. A portion of profits will also be allocated towards repaying your investments after we break even. So you don't have to be worried if we're actually going to break even, because we already have all this in plan. Now, our implementation timeline. Our implementation follows a phased approach within 6 months. Now we'll launch pilot this program in high-need states, states that we believe that actually need this healthcare system more than others, those that don't actually have access to good healthcare system, those that have actually their mortality rate is on the high level. So we'll actually start this program in those states within 6 months. We hope to have covered the states, and within 3 years, we hope to have also covered the entire 36 states in the country, which also includes the Federal Capital Territory. And while this is going on, we would also continue monitoring and evaluating. And each phase has specific metrics for success, which is focused on expanding access to quality, affordable healthcare. This deliberate scaling ensures we can refine our approach before full deployment. So all these things will be put into action, would actually checkmate all this, everything that goes on within each phase before it is being put into action. A call to action. Next slide, please. We all know that Nigeria stands at a healthcare crossroad. Our current system fails millions daily, but together we have the knowledge, the resources, and solutions to transform this crisis into an opportunity for national renewal. Today, we all ask you to sign our commitment pledge, allocating the resources and political support necessary to launch the first phase of this project within the next 90 days. This is your opportunity. This is our opportunity to be a part of a historic transformation. Like a wise man would say, the true measure of a nation isn't found in its economic indicators or global rankings, but in how it cares for its vulnerable citizens. Let future generations remember this moment as when we choose to heal, not just our healthcare system, but our nation's promise to its people. Thank you for your attention, and we welcome your questions, and most importantly, the partnership in this vital mission. Thank you very much.